Dear students, Assalamu alaikum. Today we are going to talk about our course Physiology and Immunology, course code Chem 444. This is our first online lecture. The topic of today's lecture is blood pressure. Now we move with our topic. The outline of today's lecture is we will study about what is blood pressure, then we will study about how blood pressure is measured, then we will talk about the classification of normal and abnormal values of blood pressure. This will be followed by understanding normal blood pressure in different portions of the circulatory system, and after this we will talk about hypotension and hypertension. These are the two situations that can be caused by either lowering of the blood pressure in case of hypotension, or when the blood pressure increase from normal. In this situation it is called hypertension. We will talk about this and what are the possible consequences that these can have on our body. Then we will talk about the diseases that are associated with hypotension and hypertension, because as you know that in normal situation, if the blood pressure is normal, we don't have any, it means that we don't have any blood pressure related problems. But in case blood pressure goes down, or if it increases, in both these situations, in case of hypotension and in case of hypertension, we can have problems. So we will discuss about those problems that are caused by these conditions. Now, blood pressure. The first question that comes to our mind is, what is blood pressure? It is the force exerted by the blood against any unit area of the vessel wall. This is called blood pressure. The force that is exerted by blood against any unit area of vessel wall. So blood pressure is expressed in terms of systolic pressure and diastolic pressure. Now we need to talk about this, that during each heartbeat, blood pressure varies between a maximum, that is called systolic, and a minimum, that is called diastolic pressure. So in case of blood pressure, we have these two very important situations. One is systolic, as I told you, that this is when the blood pressure is maximum, and diastolic when it is minimum. Now the blood pressure in the circulation is principally due to the pumping action of the heart. So you know that during the heartbeat it contracts and it relaxes. So it's give rise to these two kind of situation, one systolic and the other one diastolic. So we will also talk about this, how it varies in systolic and diastolic situation. Now blood pressure is measured in a unit that is called mmHg. This is millimeter of mercury. So this is a very well-known and common thing related to blood pressure. Now if we talk about the measurement of blood pressure, we know that arterial pressure is most commonly measured via a sphygmomanometer. this is the machine that is used for the measurement of blood pressure. Most of you would have seen this instrument. That you can see that the machine is placed here, and through this machine the blood pressure of any person can be measured. So this is how blood pressure is measured, and it is a very commonly used machine that most of you would have already seen. So now we turn our attention towards the classification of normal and abnormal values of blood pressure. Now, in optimal situation, in the best possible situation, is that your systolic blood pressure, as I told earlier, the maximum blood pressure should be around 120, and the diastolic blood pressure should be around 80. If the values are in this range, it is considered as optimal values of the blood pressure. Now, if there are some slight variations from these value, like for example, if the systolic blood pressure is 120 to 129 and the diastolic blood pressure is from 80 to 84, it is still considered normal. In this situation, these slight variations are possible and are acceptable. Now, another situation in which the systolic blood pressure is around 130 to 139 and the diastolic blood pressure is from 85 to 89, it is classified as high normal. So it means that it is slightly on the higher side. Now, after this comes the serious situations of blood pressure. If the blood pressure is from 140 to 159 systolic blood pressure and the diastolic blood pressure is from 90 to 99, it is classified as grade 1 hypertension. Now, if it is more like it is from 160 to the systolic blood pressure is from 160 to 179 and the diastolic blood pressure is from 100 to 109, in this situation it is classified as grade 2 hypertension. Now, in another situation, when the blood pressure is greater than or equal to 180 in systolic blood pressure and greater than or equal to 110 diastolic blood pressure, then it is classified as grade 3 hypertension. So this is a very dangerous situation in which the blood pressure is very high. Now, there is another situation in which is called isolated systolic hypertension, that is greater than or equal to 140 and less than 90. So this is classified as isolated systolic hypertension. Now, this this classification comes from European Society of Cardiology and European Society of Hypertension classification of blood pressure. So these are the optimal, normal, high, grade 1, grade 2, grade 3 hypertension values that has to be kept in mind, and these values, if it is in optimal or a normal situation, you are fine. But in case the blood pressure values, both systolic and diastolic, if they are high, these are the different types that can be dangerous. Now, when this is a very important figure, it shows that the variation of blood pressure in human body is different in different vessels. For instance, we have aorta. In aorta, you can see that the range of blood pressure is round about 120 to 180. Obviously this the peak is about systolic blood pressure, and the down peak is about diastolic blood pressure. So these are the this is the situation in aorta. And now large arteries also, you can see that the peak is around 120 mm of mercury, and the diastolic blood pressure is around about 80. Now in small arteries this value is less than large arteries. Both systolic and diastolic is somehow comparable with the large arteries, but slightly on higher side. Now when it comes to smaller arteries like arterioles, one can see a significant downward shift in the value of blood pressure. Now when it comes to capillaries, the blood pressure value is very low. Venules, more smaller veins, it's very low. The small veins, again very low value of blood pressure. And then in different large veins in vena cava, and in pulmonary arteries one can see that the value of blood pressure is very low. Arterioles and capillaries, venules and pulmonary veins, the value of the blood pressure is low. It is because these are small veins, and the blood flow, small veins and arteries, the blood flow in these is very limited, so the blood can exert a very limited pressure. So it can be expected that their blood pressure will be low. But these are the main players that are important in the measurement of blood pressure that we discussed in the previous slide. So hopefully this figure will give you idea of normal blood pressure in the different portion of the circulatory system when a person is lying in the horizontal position. So this is from the Guyton and Hall textbook of medical physiology. So you have to keep these values in mind, that blood pressure is not the same in all the different parts of the body or in all the different capillaries and veins. It can vary from different veins or arteries is their size changes. So now we talk about hypotension and hypertension. Hypotension, blood pressure that is too low is called hypotension, and blood pressure that is consistently high is called hypertension. So these are the two situations in which blood pressure can either comes down or can go up. So these are the two situations that we possibly can have. Both hypertension and hypotension have many causes and may be of sudden onset or of long duration. So it depends why a person is suffering from, say, hypertension or hypotension. It has a very detailed there can be a lot of causes of this situation, and this situation can either be sudden or they can possibly have long duration problems. So this situation varies from one situation to another. Now there are different types of diseases that are associated with the disease of hypertension or high blood pressure. Some now long-term hypertension is a risk factor for many diseases. So it can increase it means that it can increase the risk of a person and can get diseases such as the heart disease. It can cause stroke. It can cause diseases like kidney failure. One can see that all of these diseases like heart disease, stroke and kidney failure, they are very serious diseases, and they can prove to be fatal if not contained. So it is very important to keep the blood pressure in the normal range. So here is a diagram of which part or how the different parts of the body can possibly be affected by high blood pressure. Main complications, there are many other, but we are talking about the main complications of persistent high blood pressure. So the effect of persistent high blood pressure on brain is it can cause cerebrovascular accidents, that is called strokes. It can cause hypertensive encephalopathy. It can cause confusion, headache, convulsion, and in eyes it can cause hypertensive retinopathy. This is a disease of eyes that can be caused by high blood pressure. In heart, which is very vital organ, it can cause myocardial infarction, which means heart attack. It can give rise to hypertensive cardiomyopathy, which means heart failure, and it can cause elevated in blood, it can cause elevated sugar level. In kidneys, it can cause a disease called hypertensive nephropathy, chronic renal failure. This is a chronic renal failure, which renal failure means that the kidneys fail to be able to perform their function. So from this diagram you can see that these are some of the main complications that can be caused by persistent high blood pressure, and almost all of these diseases are of very serious nature. So this is very important to keep in mind, that high blood pressure can prove to be very dangerous. This is why it is very important that blood pressure should be monitored, and all the necessary measures that are necessary for maintaining a normal blood pressure should be taken before it can cause these severe problems. Now, it's not only the high blood pressure that is associated with medical conditions, and there are situations in which hypertension or low blood pressure can also be problematic, and this is also of medical concern if it causes signs or symptoms like dizziness, fainting. In extreme cases, it can lead to situation like circulatory shock. So it's not only the high blood pressure that can possibly be dangerous, but at the same time low blood pressure or hypertension is also not desirable, and this is why blood pressure has to be maintained in its optimal situation. So this is our lecture about blood pressure. I hope that you enjoyed the lecture, and if you have any question regarding this lecture, I will be very happy to answer your questions, but I am sure that this lecture will give you an idea of the importance of having normal blood pressure, like we discussed in in this slide. Now the thing is that we have to keep our blood pressure normal to avoid any serious complications that it can cause. So if you have any questions, please feel free to ask me. I will be very happy to answer all of your questions. Thank you very much for watching. See you in the next lecture.